Hi, this is Dr. Doreste with the Cranial Release Technique, and I have a great treat for you tonight. We have Dr. Clark Walters, affectionately known as Doc Cranium, over on the west coast of Florida, and we'll get Clark up here in a minute. Clark, good evening and welcome aboard.
Thank you very much, Bill.
And by the way, before I forget, where exactly are you in Florida so that people out there that may be looking for a CRT practitioner will know where you are and the town you're in, and just give us a little geography lesson. Where are you?
Right. I'm in Dunedin, which is right next to Clearwater, which is on the Gulf Coast of Florida, Pinellas County. So if you take a look at the Florida map and you see this little appendage sticking off to the side, this little peninsula, that's Pinellas County, and that's where I'm located, pretty close to the beach. And probably one of the best places in all of Dunedin. It's a nice little quaint area with old-fashioned stores, and I'm upstairs looking on Main Street, and it's just phenomenal.
Great, great. I have never been to Dunedin. I know we've been to Tampa, to Clearwater, Sarasota, but so basically you're between Clearwater and Sarasota?
No, between Clearwater and Tarpon Springs, Palm Harbor area.
Great, great.
No, Sarasota is a couple hours from here.
Okay, great. I wanted to mention, well, I wanted to ask you too. I know you have an interesting story about how you became a chiropractor, and you've been in practice a little longer than me, I think. So when did you graduate?
I graduated in '85.
85. Okay,
yeah.
Same as me. Great.
But I got into chiropractic back in the '50s.
Okay, and how did that happen?
It was November. My first chiropractic adjustment was November 19th, 1952. I was 2 days old. My father was in chiropractic college.
There you go. Very good. And you were his first patient.
No, actually, it was Dr. Murphy.
Okay.
I can remember his face now, as it gave me. No, I don't remember any of that at all. Saying that, there's a thing about chiropractic and children, as though it's done the same way with adults, like there's any danger to it at all. You know, it's always in the technique that you use. You just use a child's technique. I've had it, like I said, since I was 2 days old, and had them on a regular basis ever since.
Right.
Until released.
Right, and that brings up, in some of my videos I talk about, there is a pediatric or a children's CRT procedure. Maybe we'll touch on that, but I know Clark and I have done many of those. And so just on a side note, if you're watching this, or whenever you do happen to watch it, and you know of a child that's having a health challenge, or just you want to optimize the health of the child, you might want to consider bringing them for a CRT, even though they're just a few days old, a few months, a few years. In my opinion, the younger the better, and I'm sure Clark will agree with that. And then there's never really a time not to have CRT, so it's something that should be done throughout our life. But back to you, Clark. So you graduate chiropractic school, if I'm correct, it was Life Chiropractic College, 1985.
Yes. And
then we met, and you started dabbling in cranial. When was that? How many years back was that?
Originally, 2002. 2002.
2002.
When I was dabbling and was curious about it. And then when you started to teach the cranial release, I jumped on board because it was something that I really had a great affinity towards. And I just decided right then and there that I was going to master this because I saw the broad benefits of it. And it takes some practice to get it down right, but once you do, it's not only well worth it to you, but it's well worth it to all your patients or clients. I say that because you don't have to be a chiropractor to learn this nowadays. I mean, a good massage therapist, you know, and properly trained, could do a phenomenal job. As a matter of fact, the person who does the cranial release on me is a massage therapist who's spectacular at it, and she's just down the street. So we exchange.
Very good. Yes, and we have acupuncturists in the program, naturopaths, dentists, a medical doctor. So any licensed healthcare provider can learn the cranial release technique. Just because I don't want to keep you too long, I know you have patients to see, but in a few words, cranial release technique. Someone asks you in the street, what is it? Why do you like it? Why do you do it? Why do you recommend people have it done? What would you say to some of those questions?
It addresses one of the key issues when it comes to people's health. And when you lecture on it, it's the topic that comes up with you, and that's that the vast majority of reasons why people suffer anything, including a weakened immune system, is how your body handles and interprets your level of stress. I ask a patient, they'll come to me a lot of times with certain aches and pains. That's what usually draws them in. And I said, before we go any farther, let me ask you a question. On a scale from 1 to 10, what would you say your stress level is like? And if on 1 to 10, and 10 meaning shoot me. So don't give me a 12 or a 15. That's it. And so they'll say, I don't know, a 4 or 5 or something like that. I said, no, not your worst day, not your best, but just kind of generally. And they tell me a 4. I said, okay, when it's a 6, where do you feel it? And then sometimes it's the chest, but the vast majority of the time, it'll be right to the areas that they're complaining on when they come in here. So I've got a good idea. Before we just start working on those areas that you came in for, what do you say we release the tension that's caused by stress? See what that does. And so we take them in, I do that, and people are amazed. See, the thing is, as you had mentioned in your lectures a lot of times, it is not the heavy level of stress that comes and goes that we can get out of, but rather it's the continual low-level stress in our society that we just can't get away from. And that's the thing that weakens our immune system, makes us sick, makes us ill. So by doing this particular procedure, you ease that tension, and a lot of the problems go away all by themselves. Something else that I like about it is the universal application. To do the service appears to be very similar. The challenge is no two people are exactly alike. Every person has their own unique situation and characteristics. So it's always a pleasurable challenge to make sure that you're doing it right on each person, and then you enjoy the benefits, or they enjoy the benefits they receive afterwards. And you like it when people get off the table and say, that was fantastic. I just kind of like that stuff. Something else too is that, like I said, the universal application, and I give the analogy, it's a lot like a shower. Because people say, is your cranial release, is it good for this problem? Is it good for hernias? Is it good for some heart problems? Is it good? Whatever it happens to be. I said it's a lot like a shower. There are some people who take a shower because they're coming back from the beach, especially around here, need to shower the sand off. Other people, they had a hard workout, need to work off, get the sweat off. Someone else might be a construction worker, they got to get the dust and sweat off of them. And someone else is a kid in a mud puddle. There's no mud puddle shower, hard workout shower, construction working shower, beach shower. It's a shower. The same thing's true with this. It's a universal application just to watch people improve whatever the thing happens to be.
I think that's a great explanation. And I think a lot of our practitioners that hear this little 2 minutes that you just gave, that would be a great way, in my opinion. I never used that, but that makes a lot of sense. Thank you, Clark. That was wonderful. So
Thank you.
Great. Again, Clark Walters is in Dunedin, Florida, which is in the Clearwater area. Clark, do you have a website? Do you have a phone number? You want to give us your address, and then you'll send it to me and I'll put it in the description below anyway, but if you just want to give that to us now.
Yeah, the telephone number is 727-619-4907.
Great.
The website for right now, which is easy to go to, it's simple, it's just right now just one page. I'll be adding some more stuff later on. But it's doccrt.com.
Perfect, perfect.
And the address, 305 Main Street, Dunedin, 34698.
Beautiful.
I call the business the Cranial Care Center.
Cranial Care Center, beautiful. Clark, I guess the final question I have for you, what percentage of your patients that would come in to see you, regardless of what they're complaining about, would be receiving the CRT when they see you?
Let's see now. Oh yeah, 100%. There's nobody that doesn't get the CRT. Not like I don't do other things if I want to.
Correct. No, I know you're also a master at extremities, at wrists, at feet and ankles and things like that, and adjusting the spine. But the CRT seems to be the prime component of every office visit. Would that be correct?
I tell patients, even though I might do some other things, the only thing that you really need is the CRT.
All right.
And that sounds bizarre, but the truth is, I can get more done with a 1-minute CRT than doing a whole bunch of other stuff.
Well, that's great, Clark. I want to thank you again for your time. I want to let everyone know if you're in that area, it's worth a visit to go see Clark. You're about, what, 2 hours from Orlando, I would guess?
Correct. And I need to thank you also for all the time that we spent together and allowing me to be part of your organization, to help you teach, and to be and to listen to you as a master teacher.
Well, thank you very much, Clark. Clark is a black belt in CRT. So again, if you can get to that area, Clark is worth the trip. Again, that's Clark Walters in Dunedin, Florida. If you go to the Cranial Release website and you search Practitioner, Clark is there as well. So that's another way to reach him. But I will include all his contact details in the description below when I put this on YouTube in about 5 minutes. So thank you very much, Clark. Any final words to say to our friends?
I'm even wearing the club shirt here, the CRT on it.
You're in the club. Very good. Thank you very much, Clark. Thanks for all your time, and all the best to you and your family.
Thank you, Bill. Take care.
Thank you.